Hi everybody, Dr. Muse here with Dr. Ben Kraft, and in this video we're going to talk about hip pain, which is a pretty generic topic, but we want to talk about how we may approach something like this here at CCRC. So before we really get into the assessment and the treatment portion of the video, Dr. Kraft is going to give us a little bit of background information on the actual anatomy of the hip.
Yeah, sure. So if someone comes in with, that's their primary complaint is their hip hurts. I mean, there's a lot of different things that could be at play. You could have, some bony overgrowth and getting what's called a hip impingement. There's a labrum that circulates the hip joint and that ball and socket. So you could have an issue with the labrum. You can have something called an osteochondral defect. But it's, for us, when that walks in, statistically 71% of the time that's coming from the spine, not necessarily just the hip. So we'll get into that, but that's one of the primary things that we think of is, can we find a tissue that's aggravated or irritated or inflamed? And even if we do, we still want to rule out the other possibilities.
Right, and along that train of thought, a quote that we always go by is, he who treats the side of pain is lost. So even though you may be coming in with a hip complaint, we're not automatically just taking out our telescope and looking straight at the hip. We need to assess the areas above and below. Now, if it's hip pain, we still do want to do some kind of assessment that is going to look at the quality of the tissue in the hip. And this is where we use something called orthopedic test. An orthopedic test is just basically used to stress the tissue in the joint to see if we can provoke symptoms. So in the hip, usually if we have any sort of internal hip derangement, things like flexion, internal rotation, bringing the hip across may provoke those symptoms. So these aren't like highly scientific and difficult tests to perform. I'm basically just going to take that tissue, compress it, and just see if I can provoke their symptoms. Now, just because you may have a positive orthopedic test does not necessarily mean that we have to send you to surgery right away. So first and foremost, let's talk about the assessment. How do we look at this from a functional perspective? Yes, we're going to do the orthopedic stuff to see if there is truly some hip complaint, but then we need to figure out, okay, well, why is that there and how do we take care of it?
Yeah, so, like we said, 71% of the time it's the back, but, there may be someone that walks in with primary hip complaint. We go through our orthopedic test, we determine it to be hip bursitis or a gluteal tendinopathy, and those all have root causes, and it's usually in the way that the hip is functioning. Mm-hmm. So we'll look at, again, how well do you stabilize on that? How strong are the glutes? How balanced are you? What is your core stability? How's your core stability function? And we have to look at that whole big picture to figure out what are you doing that's irritating that bursa and causing it to inflame.
Right, so he said some really great things there. Yes, we need to be assessing the function of the joint, not just the hip itself, but what's happening in the lumbar spine. Like you said, 71%, which is a crazy high number of low back issues, are actually provoking the hip. I need to be looking at how the foot contacts the ground. How well can you stabilize from the ground up? So we're going to look at these things, and before I even talk about surgery, we should go through a trial of care. All the research in the world will tell you before surgical intervention of these hip issues, give it a couple weeks of conservative care. And we're pretty certain of our ability to give high quality conservative care. And by the end of that trial of care, let's say it's 4 to 6 weeks, if we are still having issues, then that individual is highly the right person for that surgical intervention. And when that does get to that point, then the outcomes are so much better, because oftentimes people may go to surgery first and it may not be the right thing for them, like in the case of maybe it's the low back causing it. If you go and get that surgery in the hip, but the low back has not been addressed, then there's a possibility you have a surgery that you don't even need. Now, with the functional approach, if we do all these things, if we clear the hip itself, if we clear the lumbar spine, the foot stabilizing well, and the symptoms go away, but you still have, let's say, some kind of labral fraying in the hip, well, then I don't care. If you're functioning well, if you're out of pain, then it doesn't matter. And we see that a lot in the research, where we may see these things on imaging like an MRI, but if you're functioning well, zero pain, then it doesn't matter. That could just be age-related changes in the tissue. Now, on the end stage of this, if surgery is warranted, then in that surgery, let's say it's a labral tear of the hip. The surgery itself is where they will go into the hip, they will clean up that labrum, they may even kind of reattach it in certain areas. But if that's done, there's still functional approaches that we need to address afterwards. Go work with the physical therapist. Work with us where we can then stabilize the hip, teach you how to stabilize more appropriately from the foot, and then hopefully, as we correct this function, you're not getting back into this kind of issue. Because if you only get the surgery but the functional things stay the same, then there's a solid chance that you may run back into that same kind of issue. If you or somebody that you know is experiencing hip pain or has some kind of diagnosed hip pathology, feel free to reach out to us, watch some of the other videos on the channel, give the office a call. We're here to help you, but hopefully you took something from this video, and I hope you guys have a good day. 2 done.